Okay. Hi, everyone. I see that I have three people already waiting. Thank you so much. So, we are going to jump right into tonight's discussion. And this is episode 4 of Why Are So Many People Sick Today? And so, we are going to be diving into this wonderful topic that is near and dear to my heart. And my hope is that you're able to learn one or two things that you can apply um, to your wellness journey in this year 2026. So, why are so many people sick today? Episode 4. And we are going to be talking about cholesterol as the major driver. And the topic for tonight is cholesterol, friend or foe. Cholesterol, friend or foe. So, we're going to jump right in. So we're going to try and make it interactive. So I'm going to be asking us to do a bunch of things. If you feel comfortable, um, please drop your comments in the chat. Thank you. So cholesterol friend or foe? What labs really mean? Quick question. Has anyone ever told you that your cholesterol is high and you immediately feel like you did something wrong? Tonight, I'm going to take the fear out of cholesterol because cholesterol is not just a villain, it's also a necessary building block in your body. But here's the twist: most people think cholesterol is number one. It is not. Your lab report is like a car dashboard. If you don't know what the lights mean, you might either panic or ignore it. Both can be dangerous. So, we're going to answer: is cholesterol a friend or foe? What do LDL, HDL, and triglycerides really mean? What are advanced tests like ApoB and lipoprotein A, and who should care? And most importantly, what can you start doing this week to improve your numbers and reduce your risk? I want you to type in the chat. Have you ever been told your cholesterol is high? Yes or no? All right, just a quick note. This is for educational purpose. It's not a personal medical advice. So use this information to have a better conversation with your clinician. And if you stay with me to the end, I'm going to give you a simple checklist: what to ask for and what to do based on your results. So, cholesterol 101: friend or foe? Let's start with the basics. Cholesterol is a waxy molecule your body uses to build cell membranes, make hormones, make vitamin D, make bile salts to digest fats. So, cholesterol itself isn't evil. The real issue is where it's traveling and how many particles are circulating, and whether your arteries are inflamed and vulnerable. Cholesterol is the passenger, and the lipoproteins are the cars, and the traffic matters. The cars are the LDL, HDL, and VLDL. Okay. Because cholesterol doesn't dissolve in the blood, your body packages it into little carriers called lipoproteins. So the LDL, lipoprotein, low density lipoprotein, often called bad cholesterol, more accurately, it's a delivery vehicle. It carries cholesterol to the tissues. Now you have the HDL, high density lipoprotein, often called the good cholesterol. It helps to transport cholesterol back to the liver. And then you have the VLDL and remnants, which is a very low density lipoprotein, which is closely tied to triglycerides and your metabolic health. The LDL particles can get into the arterial walls, and if the environment is inflamed, they can get retained, modified, and contribute to plaque formation. I want you to drop in the chat if you've heard LDL is bad and HDL is good, because we're going to refine that tonight. Okay, the standard lipid panel, what each number means. Most people get a standard lipid panel, and it usually includes total cholesterol, LDL cholesterol, HDL cholesterol, and the triglycerides. Now, the total cholesterol is like saying how many vehicles are on the road, but it doesn't tell you what kind of vehicles. You can have a normal total cholesterol and still have a high risk or a higher total cholesterol and have a low risk, depending on what is inside. The LDL cholesterol, the one everyone focuses on, is the amount of cholesterol inside the LDL particle. But here's the important nuance: LDL cholesterol is not always the same as LDL particle number. And sometimes LDL cholesterol is calculated and not directly measured. So if triglycerides are high, the LDL cholesterol can be less reliable. So the practical takeaway is LDL cholesterol is useful, but it's not the whole story. HDL cholesterol is the misunderstood one. HDL is often called good, but higher is not automatically better in every situation. I tell my patients HDL is like a cleanup crew, but you can't judge the quality of the cleanup crew by the number on the truck. You want function, not size. So, yes, low HDL often travels with insulin resistance and metabolic syndrome, but simply raising HDL with a pill has not magically eliminated heart risk in studies. Triglyceride, which is another metabolic health messenger that is measured, are your body's main form of fat storage and energy transport. When triglycerides are elevated, it often signals insulin resistance. So, too much refined carbs, added sugars, excess alcohol, liver fat, metabolic dysfunction, and sometimes genetics or certain medications can cause high triglycerides. And when triglycerides are very high, condition like pancreatitis, becomes a high risk and a concern when your triglyceride is actually 500 milligram per deciliter and higher. So I want you to, write in the chart if you know your triglyceride level. Do you know your triglyceride level or number? If yes, if you feel comfortable, what is it? Now we're going to talk about the non HDL cholesterol. And this is the underrated MVP. Now, I want to give you a lab marker that many people never talk about, but it's powerful. Non HDL cholesterol. And this is the total cholesterol minus the HDL. The non HDL cholesterol represents all the potential atherogenic, meaning plaque forming particles. And so this is the LDL plus the remnant. So when you take away HDL, is the LDL plus remnants. And so when these are elevated, this can be a problem because this is actually a better big picture than just looking at the LDL cholesterol alone. The non HDL is like counting all the vehicles that could cause trouble and not just on one lane. Advanced labs, when the basic panel is not enough, these can be ordered. And now so we're going to talk about them. There are two of them of the advanced labs. This test can be a game changer for certain people. Number one is ApoB, which is the apolipoprotein B. And this is the protein that sits on the surface of the atherogenic particles. So LDL and many remnants. Here's why this matters. One ApoB equals one atherogenic particle. So ApoB is essentially a particle count. And how many cars that can enter into the arterial walls that are on the road? Now, professional groups like the American College of Cardiology have highlighted that the ApoB has a strong association with cardiovascular risk and its relationship to the non HDL. Now, who should consider ApoB? People with high triglycerides, diabetes, prediabetes, metabolic syndrome, fatty liver, maybe normal LDL cholesterol, but you have a strong family history or unexplained risks, such as like sudden death in the family. The second test is the lipoprotein A, and this is mostly genetic. The lipoprotein A is like it's like LDL with an extra protein attached, and it's largely genetic, like I said. Now, what's important is this: many experts recommend measuring it at least once in every adult because if it's high, your strategy actually changes. Okay. The guidance that we've received from different associations, like the National Lipid Association, recommends to check it once in a lifetime. Now, who should care about lipoprotein A? If you have a family history of early heart disease or stroke or heart disease, despite your LDL cholesterol being okay, known aortic valve disease, or honestly, anyone who wants a fuller risk picture once in a lifetime. So, what is the important point here? If your lipoprotein A is high, don't panic. It does not mean doom. It means let's control everything even better, especially your LDL and lifestyle. Cholesterol isn't the only story inflammation plus insulin resistance. So let's connect this to our series. Why are so many people sick today? This is a huge driver, and that is metabolic syndrome, insulin resistance, which is often fueled by consumption of ultra processed foods, low movement, poor sleep, chronic stress. And in that environment, the lipids behave differently. Triglycerides they rise, the HDL cholesterol drops, the LDL particles can become smaller and more dense, and inflammation makes the arteries more vulnerable. So cholesterol risk is not just about fat in the blood, it's about the terrain, the whole metabolism, or the whole metabolic environment. How clinicians actually decide what to do. Let me take us on a practical journey. When we decide the next step, we don't look at one number. We look at the age of the individual, the blood pressure, smoking status, if the individual has diabetes or prediabetes, family history, and the overall risk over time. In the United States, bodies like the United States Preventive Service Task Force recommend considering statins for primary prevention in adults who are between 40 and 75 years old with risk factors and sufficient estimated 10-year risk. And for people who already have a known cardiovascular disease, many guidelines focuses on lowering LDL aggressively. A common threshold discussed for a very high risk patient is targeting an LDL cholesterol below 70 and even escalating the therapy further if above that. In some European association, in very high risk targets or high risk patients, they even recommend lowering the LDL cholesterol below 55 milligrams per deciliter. Here's my big message: don't self diagnose from a number. Use the number to start the right conversation. What you can do this week. We're going to talk about something that is simple, traditional, proven habits. Now, let's talk about action because wellness is not a theory. Number one, food. Let's make it boring and consistent in a good way. Build meals around real proteins with vegetables, and also with things like beans and lentils and whole grains. Let's choose healthy fats, olive oil, nuts, avocado, fatty fish. Let's reduce added sugar and refined starches. This is huge for triglycerides. Let's aim for 25 to 40 grams of fiber per day. Fiber helps to bind bile acids and improve the lipid metabolism. Two, movement. We're talking about walking plus, strength. So the old school combo, it still wins. Walk daily, even 10 to 20 minutes after meals. This help. Aim for 7 to 10,000 steps per day as a strong goal for most adults. Even uh, there's benefit shows that it shows up, of course, even before 10,000 steps. I know we talk about 10,000 steps, but this range is where improvement becomes more consistent. If you are 60 and older, now, if you're 60 and older, 60 and older, I said yes, and many outcomes like overall health and longevity is linked to how much steps we're able to take. Around 6,000 to 8,000 steps per day is a very reasonable target. So, if you're 60 and older and you want to live long and be in health, 6,000 to 8,000 steps per day should be the target. If you're currently walking but you're under 4,000 steps per day, don't jump don't just jump straight into 10,000 steps per day. 10,000 steps per day. Add 1,000 steps per day every 1 to 2 weeks until you reach 7,000 plus. And that is a gradual build that is good for your body. Okay? So you don't just jump start to 10,000. You add 1,000 steps per day every 1 to 2 weeks until you reach 7,000. And that gradual build is usually the sweet spot for consistency. If your main goal is you want to work on your glucose and insulin resistance, the evidence shows that taking a walk after meals, 10 to 20 minutes, is a good goal. I'm going to say that again. If your main goal is to work on glucose and insulin resistance, then taking a walk 10 to 20 minutes after meals is a good goal. The evidence suggests a meaningful effect often occurs in 4,500 to 9,000 steps per day. So, which is great. Now, you can still win. We talked about even if you're not able to make 10,000 steps per day, if you're not hitting 10,000 steps a day, it is so important to keep moving. Keep moving. Keep taking those steps. And there are so many ways today by which we can track to see where we are. 4,500 to 9,000 steps per day. That's the zone. That's the winning zone. Now, also, we talked about strength training 2 to 3 times a week, and this helps to improve insulin resistance. And this is something that is easily done and something that we can do at home without even leaving the comfort of our own home. So let's focus on that. Besides trying to hit 10,000 steps a day, strength training 2 to 3 times a week, it helps to improve insulin resistance and the body composition. Okay, so what is a third thing? Sleep and stress, because your hormones, they drive your lab results. They drive what is going on metabolically. So poor sleep, we talked about this last week, increases cravings, increases insulin resistance, and causes weight gain. So, chronic stress pushes behaviors and our biology in the wrong direction. Last week, we talked about the hunger hormone called ghrelin and the satiety hormone called leptin. And we said chronic stress actually pushes them out of sync. All right. So we know that chronic stress pushes behaviors and biology in the wrong direction. And so basically, managing our stress levels are really, truly very important. And there are many ways by which we can manage chronic stress. Last week, we talked about things like, meditation, journaling, walking, you know, sleeping. There are so many ways by which we can manage chronic stress. So, what is the other thing that we need to focus on? Alcohol, alcohol consumption, because we know that a high number, uh, a high triglycerides is linked to high consumption of alcohol. So, keeping that in check as well is one of the things that we can start doing from today. If your triglycerides are high, you know, alcohol is like pouring gasoline on the fire. So let's wrap it up. Tonight, you learned cholesterol is necessary, but risk depend on the lipoproteins plus inflammation plus metabolism. LDL cholesterol is helpful, but ApoB can reveal hidden particle risk, according to the American College of Cardiology. Lipoprotein A is largely genetic and is worth checking at least once in a lifetime for many adults. Triglycerides are often your metabolic messengers, and very high levels raises pancreatitis concern. If you found this helpful, I want you to hit like, subscribe, and share with someone who gets anxious every time they see a cholesterol panel or who care about their health. We will continue these conversations next week, starting with reversal strategies for some of these medical conditions. I hope you'll join me next week. I remain Dr. Olubumi Bolaji. If you need a proactive PCP to help you navigate your health and wellness journey, and you live in the New York area, please give us a call, 631 486 4834, 631 486 4834. We are located here in Comac, New York. I hope to see you in the next video. If you have any questions, I want you to type in the chat and I will be happy to help answer them. So if you have not had, I know we're just in February, but if you have not had your cholesterol checked in the last 1 year, please have these conversations with your primary care physician. These are really, really very important conversations because unfortunately, cholesterol is one of those things that can cause major cardiovascular risk, but you don't even know that anything is happening inside of your body. Unfortunately, it does not even give you a headache, it doesn't give any symptoms, and most people, unless your doctor checks you out, will never know that their cholesterol is out of whack. Will never know until, God forbid, they get that major heart attack or chest pain or difficulty breathing, and the doctor says, "Hey, you just had a heart attack." or God forbid, a stroke because the arteries or the arterial walls have been clogged with cholesterol. So I hope you would implement one or two things that we spoke about tonight. Again, these conversations are so necessary, and the reason is very simple. I truly, truly believe that food is medicine. I truly, truly believe that eating the right food will help to heal our bodies. And eating the wrong food definitely causes illnesses and diseases. And so once we arm ourselves with this information, we can make better choices so that we can enjoy this body that we have been gifted with. So I don't see any questions in the chat. I want to thank everyone. I know it's Valentine's night tonight. I appreciate you taking your time out of your busy schedule to join me. And we'll meet again next week. Next week, we will focus for the next 4 weeks talking about reversal of chronic conditions, how we can reverse these chronic conditions. I think someone has a question here. Yes, I see a question here. When you see HDL and LDL in your blood work, does that mean your cholesterol is checked or the test is separate? Yes, the lipid panel will include that. It means that they checked your cholesterol. Yes, it means your cholesterol was checked. Yes. And those numbers really are really important. And it's always good to know those numbers. It's always good to have the conversation with your doctor. It's good to have a copy of your blood work even before you go to see your doctor so you can bring your questions, instead of just the doctor saying, hey, everything is fine, and then you go home feeling, oh, everything is fine. It's always good to ask questions. So what is my HDL, what is my LDL, what is my hemoglobin A1C, those kind of conversations. All right, thank you so much, everyone. um, I don't think we have any more questions. We will meet again by God's grace next week. Thank you. Oh, there's a question just came in. How often should this be checked? So your lipid panel, which is your cholesterol panel, should be checked at least once a year. At least once a year. And then based on the result, your doctor will discuss with you if they want to do like something called like a short-term follow-up, or they want to do or you're good and all you need to do is follow up again in 1 year when you come back for your physical. So it may go from at least 1 year to every 3 months or every 6 months, depending on what is going on with your cholesterol. So but at least once a year you should have your cholesterol checked. Thank you. That's an amazing question. Thank you so much. All right. I think basically that's it. I don't see any more questions in the chat. Yeah, thank you so much, and enjoy your evening. I truly appreciate your time. Thank you, everyone.